Hello everyone and welcome back to another video this week that we're doing on our series on sugar. Today we're going to be talking about how sugar specifically affects different aspects of our health and in particular our metabolic health. We're going to be doing these videos all throughout the week with the videos later in the week talking about other aspects of health like your cardiovascular health, and your brain health as well. But today it's all about metabolic health, which I'll cover in a second. What I mean by this is essentially how the body uses sugar and other foods as a fuel source, and then what starts to happen when this goes wrong as well in the form of chronic disease. So some of the conditions that we're going to be talking about today include obesity, which could be a month-long topic in itself, but I'm just going to try and keep it short and sharp for today. The other ones include type 2 diabetes and how insulin plays a role in this disease as well, non-alcoholic fatty liver disease, and also something called the metabolic syndrome, which I'll explain a little bit more on in just a moment. If you're watching the video, feel free to post a comment, say hello. I'll try and get to everyone that pops up. But there's a lot of content to cover for today, so I'm just going to get straight into it. So the big question for today and all of the presentations this week is, how does the overconsumption of sugar lead to metabolic ill health? So from last week's videos, we can understand how sugar, so fructose and glucose, can lead to problems with our insulin, which is a hormone produced by the pancreas. We can see that glucose is going to spike up our blood glucose levels and therefore spike up our insulin levels as well, leading to something that we call chronic hyperinsulinemia, high levels of insulin. And when sugar is constantly ingested during the day and all throughout the day, this gets worse and worse. And we know that fructose also damages and overworks the liver, leading to insulin resistance in the liver and other tissues as well. And it's these two problems with insulin, that's where we see, I guess if you like to think of it as the root cause of a lot of the metabolic ill health in today's society. So the first thing I wanted to talk about and cover in regards to how sugar affects our metabolic health is obesity. So we know from last week that hyperinsulinemia, so high levels of insulin, actually one of its roles is to promote fat storage. And this is an evolutionary role that's evolved over many, many years to store energy for the times when maybe there wouldn't have been as an abundant a food source or supply. So if you think of it, many, many thousands of years ago, one person or someone has something to eat, overconsumes things, insulin is produced, and we store that energy. This, however, in today's society where we've got ready access to food and overconsumption of food, there's now actually more people in the world dying of overconsumption of food compared to underconsumption. It's just not, even though it's an evolutionary sort of pathway, it's not as relevant for storing energy anymore. However, the body still does it. We know that insulin also promotes, in the presence of excess sugar, something called liver de novo lipogenesis, so new fat cell creation, and then deposits these fat cells around the organs and around the body as well. The increased insulin resistance also equals worse liver function, which is pretty crucial in playing a role in our metabolic health. This further leads to fat storage, specifically at the liver, and visceral sites or other organs like the pancreas and the kidneys, as well as other adipose tissue stores around the body, so hips, legs, those kind of things. It's a very, very brief summary of how overconsumption of sugar impacts obesity, but I think the basic way to put it is we see sugar overconsumption leads to high levels of insulin and insulin resistance, and that's where we get the fat deposition around our organs and around the body as well, and obesity as we see it in society. All right, so next thing I wanted to talk about for today, a brief cover over something called metabolic syndrome. Now, this isn't something that a lot of people might say that they have or even know that they have, but essentially it's a combination of metabolic health issues or risk factors that together or when combined increase the overall risk of cardiovascular disease and mortality as well. And having 3 out of the 5 of these can qualify someone for having metabolic syndrome. So the five categories or risk factors, if you will, I'll go through them now just briefly. So the first one is the presence of visceral adiposity, so fat around your midsection, around your organs. I've just spoken a little bit about that, so I'm not going to dive too deep into that one, but that's the first risk factor. The second risk factor is an increase in blood pressure. And you might be thinking, well, how can sugar consumption possibly impact my blood pressure? We know that blood pressure is multifactorial, so there's lots of different things that get impacted. How you're sleeping, your stress levels, exercise levels as well, but also what you're eating has a huge role to play. So one of the many pathways and roles that sugar and therefore insulin has to play is if we've got high levels of insulin around the body and in the blood, that's going to lead to an elevation in another hormone called aldosterone. And this hormone is responsible for sodium conservation in the kidneys, or salt retention, essentially. What happens then if we're keeping in more salt than we normally would and not excreting it out in our urine? Essentially, if there's more than in the cells and in the blood, then we need to retain more fluid to maintain a homeostatic balance in the concentrations of salt. Too much or too little salt, not a good thing. So the body likes to keep it steady. But if we're retaining lots of salt, we're going to retain fluid as well. And if you've got more fluid, you've got more pressure on your arteries and on your blood vessels, and therefore a higher blood pressure as well. So increased blood pressure is another risk factor for metabolic syndrome. The third risk factor we know is insulin resistance at the tissues, so liver, pancreas, kidneys, muscle, heart, all of those. We've seen, and I've spoken quite a bit about the vicious cycle of high levels of insulin and insulin resistance, and this worsens with sugar consumption. So I won't dive too much deeper into that. The fourth risk factor is elevated triglycerides in the blood. So triglycerides is a fancy word for different fats, and it's essentially describes their chemical makeup. When we see high levels of insulin and an increase in de novo lipogenesis, so new fat creation in the liver through sugar consumption, the fat that's created has to go somewhere. It can't just permanently stay in the liver. And we know it goes to other organs and other sites of the body, like I just mentioned. But how does it get there? So we know that it's exported attached to something called a very low density lipoprotein. Okay, so lipoprotein is a molecule made up of fat and protein, and other things can bind to it to be transported around the body. And we know that when the liver is making lots of fat, it's going to export it as triglycerides riding on the back of this VLDL, very low density lipoprotein, around the body. And this shows up in the blood as elevated levels of triglycerides. So elevated fats in the body. And this can go to the heart, can go to other organs as well, where it can really do some damage. And the last risk factor in metabolic syndrome is a reduced HDL cholesterol. So that's also known as the good cholesterol, if you want to think of it that way. And we want higher levels of this kind of cholesterol in our body because it reduces the amount of calcification and plaque buildup around our arteries as well. So we want more of it in our body. This essentially reduces the risk of cardiovascular disease, and we'd actually like, in an ideal world, a high HDL to triglyceride ratio. So higher levels of HDL, lower levels of triglyceride. It's going to mean if we can get a ratio that's closer towards 1 as opposed to, you know, much higher than that, that's going to be a good thing. So when we combine all of these 5 factors, and remember, you only need to have 3 out of the 5 to be considered as someone that might have metabolic syndrome. That's what happens. Essentially, that's where the disease sort of state comes from. We know that in the USA, which obviously is not Australia, but the profile is likely quite similar. It's assumed that almost 9 out of 10, so 88% of the adult population is considered metabolically unfit. So has one of these 5 risk factors that I've just spoken about, which is a crazy high number, and something that we're starting to see all over the world as well. So yeah, it paints a bit of a shocking picture, but the other thing about all of these is all these 5, there's only one that's going to really show up with any obvious signs and symptoms, and that's the visceral adiposity. And you can see when you might be getting a little bit bigger or a bit of a beer belly or something like that. But the other ones, they're not going to show up unless you have your blood pressure tested or your insulin levels tested or your triglycerides tested. So a lot of people can be walking around with these and not know it. And that contributes to a lot of metabolic ill health in Australia and also around the world. And the important factor about all these is that sugar makes them all worse. So sugar and high levels of insulin is going to make all of what I've just spoken about a whole lot worse. Moving on now to the next condition that I wanted to talk about, and it's called non-alcoholic fatty liver disease, or NAFLD. And essentially, like the name suggests, it's increased levels of fat in the liver, fatty liver disease. In the past, fatty liver disease has typically been caused by excess alcohol, and you've probably heard of, people, chronic alcohol consumers, having liver damage, cirrhosis of the liver, needing a liver transplant even when things get really bad. And remember, if you cast your mind back to the first presentation that I did last week, we know that alcohol and fructose metabolism is identical. The liver processes it all, and there's no difference between the two. So now we can see how a non-alcoholic fatty liver disease might come about. And it's through consumption of processed foods and sugars. So when we see that, in particular foods that are high in fructose or sucrose, which we know has got fructose in it, it goes to the liver. The liver is the only one that can process it. And over time, we see disruption of the liver's ability to do its job because it's so overworked. This non-alcoholic fatty liver disease works on a bit of a spectrum as well. So it can progress and get worse and worse and cause scarring on the liver, which can then lead to cirrhosis of the liver, like I've said, which is a progressed disease state, as well as eventual liver death and need for transport. So this can be deadly if it gets to a point where it's well out of control. And this takes many years to get to this point. The interesting thing, well, maybe not interesting, but something to note about non-alcoholic fatty liver disease is that it's probably underdiagnosed because there's no obvious signs and symptoms of it, unless you get to the point where it's completely out of control and your skin starts changing color and your body's not functioning well. People can go on with having a fatty liver and not know it. The only way that it can be detected and confirmed is with liver enzyme tests or a biopsy, which can be pretty invasive, but it's something that, probably, again, a large population have and don't know about. So, and another thing, we know that, as I've mentioned before, increased levels of sugar in the diet, high levels of insulin, worse insulin resistance at the liver. We can see the connection there again. You can probably tell there's some themes popping up about sugar consumption and all this metabolic health, or at least I hope you can see that. So on to our last chronic health disease topic for today, and that's arguably the biggest and probably most common or most well known out of all of them. That's type 2 diabetes. So we know that unfortunately it's becoming more and more prevalent worldwide in third world countries and first world countries. It doesn't discriminate, and we can see that the rise in this metabolic condition is consistent with the rise in sugar consumption as well. And we're starting to see, populations that have had zero type 2 diabetes in the past. So China and parts of Asia, Aboriginal Australians, places like Mexico and South America have really the prevalence of type 2 diabetes has exploded in these populations since the introduction of sugar and sugar sweetened beverages as well, like soft drinks. I know there's places in Australia where in some rural towns it's much easier to get soft drink than it is fresh and clean drinking water. Not saying that it's not available, but it's just easier and cheaper to get soft drink in these places. So why wouldn't people drink this drink that tastes really good and is cheap? But then we start to see some really bad health outcomes as well. We know that mortality or your risk of death increases with type 2 diabetes, but it's not often the direct or root cause of death, but it can make other things like type 2 diabetes, fatty liver disease, and Alzheimer's disease much, much worse. It's important to note as well that type 2 diabetes doesn't discriminate between body size. You can be fat and healthy. You can be fat and sick with type 2 diabetes and other chronic health conditions, but you can also be thin and sick as well. And there's an acronym, a name for this. It's called TOFI, or TOFI, thin on the outside, fat on the inside. We know that overconsumption of sugar leads to visceral adiposity and liver fat as well, and that's where we see the progression of disease. We know that even though there's high amounts of people in, say, Asia with the disease, and America or in Australia with the disease, in America and Australia, we're much more likely to see, bigger body types or people that are carrying lots of fat and obviously around their body with type 2 diabetes, so fat and sick, but we can see it the other way around as well. And this shows up particularly in Asian populations where people are still thin but have fat around the organs and fat around the liver, and that's where we see the disease come up. So type 2 diabetes, the clinical, diagnosis progresses over many decades or years to get to a point where there's worsening of insulin resistance at the liver, too overworked, and hyperinsulinemia to compensate and maintain normal blood glucose levels. We see, and I've spoken about this before, the vicious cycle between the two. So over time, like I said, decades, sometimes quicker, there is an unfortunate rise in childhood type 2 diabetes now as well, all over the world. So it can happen quite quickly. Essentially what happens is the pancreas can no longer produce insulin effectively due to being overworked for such a long time. So the tissues are insulin resistant. That means we need more and more insulin to maintain the blood glucose levels stable, but it gets to a point where the pancreas just can't produce the insulin it needs, and that's when we start to see blood glucose levels slowly creep up. And that's where you start to see symptoms as well. So lots of thirst, frequent urination, dizziness, things like that. That's when the symptoms start to come into it as well. And these are the kind of hallmark signs of type 2 diabetes. Insulin production, no longer effective at this point. There's just too much fat and sugar in the cells and in the organs that need to function. It is important to note that type 2 diabetes, like all metabolic disease, can be reversed. So it's not just a chronic progressive disease that continues to get worse and worse over time. You absolutely can do something about it. So elevated blood glucose levels. So we know this is, and people with type 2 diabetes will know all about this, high levels of glucose in the blood, depending highly on what you eat, how you're sleeping, how you're exercising, not something we want. So like we stated last Friday, Jack and I, this would constitute a toxic environment for our cells. This can lead to all kinds of what we call microvascular damage. So this, the tiny blood vessels that supply your eyes, your kidneys, and your extremities can lead to circulatory issues as well. But it can also lead to macrovascular damage too. So damage to your heart tissue and brain tissue, and increased risk of stroke as well. And this is where we see type 2 diabetes damage at the most, and when it becomes lethal, essentially, at the very end of the disease state. So I spoke just a moment ago about it's not progressive, it doesn't continue to get worse and worse, it is reversible. So how? I mean, if it's continually getting worse and worse as a population worldwide, but we can reverse it, why is it not getting better across the world? So there's a couple of things that we can do to improve your diabetes, and I'm going to use some analogies along the way, so I hope it makes it a little bit more sense. If we think about a bathtub, so a bathtub, you turn the taps on full blast, it's filling up with water. What happens? So when the bathtub starts to overflow, what is the best way to stop that? What are the best ways, I should say, to stop that happening? So this analogy, I would compare it to the cells that are loaded with too much sugar in them, essentially. There's a constant stream of sugar and fat going into the cells, and they're just overflowing with it, and that's where we see the disease state. So how would you start to empty the bathtub? Would you start to get in there and get a bucket and shovel it out? You could do that. You could try that, and that's what medications do to help manage the blood glucose levels, and they do that effectively. You could take the plug out, so you're not going to get the cells or the bathtub filling up as quickly with sugar and fat. You could even somehow build up some walls on the bath to make it bigger so that it can hold more, or in other words, making the tissues more insulin sensitive with things like exercise and medication. Yes, you can do all of these, and they're going to help. So medications will help to a point in managing the blood glucose levels. Exercise is absolutely essential in managing it as well. But we haven't gotten to the root cause, and that's that there's too much water going into the bathtub, or sugar and insulin and fat in the body and in the cells. So what's the best way to do it? Well, you turn off the tap, or you turn off the supply of sugar. And we can do that with low carbohydrate diets, eliminating sugar from your diet, and fasting as well, which I'm not going to go too far into, but it is an area of lots of promise for managing type 2 diabetes. So I hope that made a little bit of sense. Essentially what I'm trying to get across is in a disease state with type 2 diabetes, there's sugar and fat overload into the cells, and we need to try and get it out faster than it's coming in. So in order to do that, not only should we try and exercise to improve our tissue sensitivity to insulin, not only should we potentially use medications as well, but we should turn off the source, which is too much sugar in your diet, and therefore high levels of insulin. So I hope that made a bit of sense, but essentially outlining how it is all reversible as well. So I mentioned before that things have been it's not getting better as a population of Australia and around the world. And for a long time, the first line of treatment has been medication to lower your blood glucose levels, and this certainly works if the goal is to stabilize your blood glucose levels. Fantastic. You've got normalized blood glucose levels, that's good, but things can still get worse from there because we haven't addressed the root cause of the disease, and that is the insulin. So the high levels of insulin and insulin resistance at the tissues. In fact, sometimes we give more insulin to manage the blood glucose levels, further leading to worsening metabolic health, worsening obesity, but blood sugar levels are stable. So that means we don't see the microvascular and macrovascular damage and complications. So you can live longer like this with the stabilized blood glucose levels, but you haven't addressed the root cause of the disease, and that's too much sugar and too much insulin. So I want to also outline here as well, for anyone that's watching, medications certainly have their place, and please do not take any of this as medical advice to change what you're doing. You should definitely talk to your doctor and discuss what's going to be the best plan for you, okay? But care and treatment now, in my opinion, should certainly focus on diet and exercise interventions to help manage it. And this goes for type 2 diabetes and all metabolic health, in my opinion. Lots and lots of content for today. Lots and lots of sometimes complex information as well. So I hope that I've got across how we can see how sugar consumption and overconsumption of sugar can lead to insulin issues that are at the root cause of most, if not all, metabolic chronic health in Australia and around the world today. If we take out the sugar from the diet, we're going to see improved metabolic health. There's no doubt about that. It is absolutely not needed for optimal human health or function, and it's likely making things worse. It's pretty blunt, but I think that's probably the best way to get the message across. So I hope you've found today's information useful, beneficial maybe, and got something out of it as well. If you know someone with any of these conditions that we've discussed, or who would really like to watch these videos or get something out of the content, please invite them to like the page, share the video with them if possible. And if you yourself have had some success stories or got any questions about metabolic health, please reach out, post a comment, and let me know, because I'd love to address some of these questions too. And later in the week, we're going to be discussing cardiovascular health and sugar, and also probably touch on a little bit of fat in the diet as well, which is been public enemy #1 when it comes to cardiovascular disease for a long time. Maybe not ideally so. We might have been going after the wrong thing there, but I'll talk more about that on Wednesday. I really hope everyone that's watched or is watching has gotten something out of the videos, and I will see you all on Wednesday afternoon. Have a good afternoon. Bye.